As we wait for a coronavirus vaccine, leading health experts want to make sure politics don't interfere with safety or science.
Health and Human Services Secretary Alex Azar talked to our Sean Boyd about vaccine development. Sean, the president says he thinks we can have a vaccine by Election Day.
That is looking less likely, though, Karen. In my interview with Secretary Azar today, he would not commit to having a vaccine by November 3rd. He told me the timing will be what the timing is, and it will be up to the FDA.
And at the end of the day, it's going to be FDA making the call on whether a vaccine is safe and effective for the American people.
Secretary of Health and Human Services Alex Azar insisted politics will play no role in the approval of a COVID-19 vaccine after the New York Times reported the White House was blocking release of a new FDA guideline that would delay a vaccine until after the election.
Is that true? And if so, why?
Well, I'm not going to get into that. The FDA, though, has communicated with the manufacturers already what it would expect to and want to see in terms of emergency use authorization.
While Azar wouldn't talk about the report, he defended the vaccine approval process.
We don't even get data out of clinical trials until an independent data and safety monitoring board concludes that that data standard has been met. Second, the drug company has to determine that data meets their independent ethical standards to submit an application for approval. Third, the FDA has published the standards and the data that it expects to see and will hold manufacturers to. And fourth, there'll be an independent advisory committee process that's public to review that information and give FDA advice. And fifth, it will be the career officials of FDA who make the ultimate decision on approving a vaccine.
Even before approval, pharmaceutical companies are producing millions of doses, and Azar says everyone who wants a vaccine will be able to get one by late March, early April.
Vaccine will start getting distributed within 24 hours of an FDA authorization.
Now, late this afternoon, the White House did drop its objection to the FDA guidance, which says trial participants should be followed for 2 months after the last dose before vaccine approval. Azar told me the president has also ordered the distribution of 150 million rapid tests, most of which he says will likely go to schools. And while we don't have a COVID-19 vaccine, we do have a flu vaccine, and the secretary strongly recommended getting that. Karen.